We continue with the Luo-Connecting points. DU1, long, strong. Location on the midline, midway between the tip of the coccyx and the anus. How to find? First, locate the coccyx superior to the anus, then palpate for its tip. The tip of the coccyx, palpate the pressure towards the anus. DU1 can often be located based on strong Nietzsche sensation. Ren 1 is located anterior to the anus, posterior to the genitals. Bladder 35 is located 0.5 tune lateral to the midline at the level of the tip of the coccyx. Needling after thorough disinfection vertically 0.5 to 1 tune. Avoid puncturing the rectum. For the action and indication, DU1 clears damp heat, lifts the chi, opens the channel and alleviates pain, calms the shen. For the special features, DU1 is a Luo-Connecting point, meeting point with Ren-Mai, GB, and kidney channels. DU1 is the beginning and connecting point of the governing vessel. Being the connecting point, it connects with the directing vessel. It can therefore be used to eliminate obstruction from both the directing and the governing vessel. For this reason, it affects both the lower orifices. DU1 is very much used as a local point for prolapse of the anus. It also resolves damp heat in the anus and is therefore used for hemorrhoids. Being at the lowermost end of the governing vessel, DU1 can be used to affect the top part, that is the brain. It is therefore used to calm the mind and open the mind's orifices in mental diseases characterized by agitation and hypomania. DU1 regulates the governing and directing vessels. It resolves dampness, regulates the lower orifices, having painful urination, difficult urination, retention of urine, dark urine, hemorrhoids, difficult defecation, diarrhea, prolapse of rectum. Also calms the mind and opens the mind's orifices, those having manic depression, and also extinguishes the interior wind, those having opisthotonus, tetany, epilepsy, tremors of head. DU1 is the first point and the Luo-Connecting point of the governing vessel, and all its indications reflect the pathways and function of the governing vessel, principal and Luo-Connecting pathways. The governing vessel winds around the anus, and DU1 is an important local point in the treatment of hemorrhoids, prolapse of the rectum, and disorders of defecation. The governing vessels enter the kidneys and its anterior pathway winds around the genitals. DU1 is therefore also indicated for various disorders of urination, such as painful urinary dysfunction, difficult urination, and retention of urine, as well as sexual taxation and unusual symptoms of seminal emission induced by fear and fright, emotions which classically considered to injure the kidney and heart. The governing vessel ascends along the entire length of the spinal column and enters the brain, while its Luo-Connecting channel spreads in the occiput, as well as the lumbar and sacral pain and stiffness of the spine. DU1 is indicated for heaviness of the head. The spiritual pivot gives a specific indication for disorders of the governing Luo-Connecting channel. It is excess. There is stiffness of the spine, and if deficient, there is heaviness of the head and shaking of the head. Although the heart is most frequently cited as the residence of the spirit, since its early beginning, Chinese medicine has been able to hold the concurrent belief that the head and brain also influence the spirit. Thus, the essential question stated the head is the residence of the intelligence. The San Simiao in the Thousand Ducat formula said, the head is the supreme leader, the place where man's spirit concentrates. Since the governing vessel enters the brain and its anterior pathway ascends through the heart, DU1 is indicated for such manifestation of disordered spirit as mania, mud walking and fright epilepsy, as well as for pain of the heart. According to Qigong theory, there are three important gates or passes in the practice of qi circulation through the governing vessel. These gates through which it is more difficult to circulate the qi are the coccyx pass in the region of DU1, the lumbar pass in the region of Pingmen DU4, and the occipital pass in the region of bladder 9. DU1 has been accorded a great variety of different names. Its best known, long strong, is said to refer either to governing vessel, of which this is the first point, which is long and strong, or to this point's ability to make the penis long and strong. Alternative names include long push, dragon and tiger point, heavenward looking summit, and stairway to heaven.